Welcome to the Newark Regional Business Partnerships Engage in Exchange podcast. Join us for business insights and meaningful conversations with NRBP's member organizations. Thank you to our podcast host sponsor, the Martin Tuchman School of Management at NJIT. Additional support for NRBP's Engage in Exchange podcast is provided by PSEG, New Jersey Urban News, Main Street Advisory, LLC. Hello, I'm Ferlanda Fox-Nixon, President and CEO of the Newark Regional Business Partnership. We are the premier Chamber of Commerce for the Greater Newark region. Our guest today is Mariekarl Vilceus-Talty, President and CEO of Partnership for Maternal and Child Health of New Jersey. Hello, Mariekarl.
Hello.
Thank you for joining us today.
Thank you. I'm so excited.
So we're going to kick this off with you just telling us a little bit about yourself.
Well, I'm a native New Yorker.
Okay. I'm from upstate New York.
Okay.
The Albany area.
Okay. My husband's from Buffalo.
Okay.
So I'm from Long Island.
Okay.
Born and raised in Brooklyn. Mm-hmm. So that's very exciting. Now live in Jersey. Mm-hmm. So my kids are always like, when we go away, and they're like, where are you from? And I always say New York, and they're like, just say Jersey. And I'm like, no, but I'm from New York. So native New Yorker. I'm a nurse. I've been a nurse for quite a long time, which I love. Haitian American. Okay. So I got to always say that. So sac passe. Love being in Jersey, and I really do love running the partnership. Have 2 children, Asher and Delphine, whom I love so much, and my husband is a writer. So that's a little bit about me.
Well, talk about the partnership. Talk about your organization.
The Partnership for Maternal and Child Health is an excellent organization. We have been in existence serving the 8 counties of northern New Jersey for about the past 30 years. Okay. Started in a small little office in St. Joe's in Patterson. And ever since then, we have been working on maternal health needs, supporting families, women, children, and their families ever since then, specifically empowering, educating, and providing direct and indirect needs through 30 different programs. And one of the things that we do is we support the 22 hospitals and 4 birthing centers within our region. We have 30 to 40 different programs that we do, and we work very closely with the state. So we have a lot of state-funded programs, and then we have some programs that are funded by private donors. In that, what we really, really do love is working with the public and making sure that they have access, education, working with our state legislators, making sure that the public is empowered. And one of the things that people don't know about us is that they think it is for a specific segment of the population, which is a misnomer that we're attempting to change. We work very closely with our subgrantees, so the people that have boots on the ground, to really empower people.
Can you talk about the roles that you have on staff? So who's on your payroll? Who are your vendors, contractors, or can you talk about that?
So that is the wonderful thing, because working within the 8 counties of northern New Jersey, you know that we are a melting pot. We have 4 of the most diverse cities in New Jersey, 4 of the most largest cities in New Jersey. So the languages that we speak are very diverse, about 104 languages. Oh, wow. So our employees come from, our counties. So we have nurses, we have doulas, we have community health workers from all walks of life and all parts of the community. So when we talk about we work with the community, those sub-grantees, and one of the really exciting things with working with NRBP is that you really get us connected to the community. So that is a really great endeavor and collaboration that we have. One of the very exciting programs that we have is the connecting, is our Family Connects.
Okay.
So the Family Connects is a universal home visiting program that the community is getting to know, but they are really not aware that it is for everyone, hence universal home visiting.
Okay.
So universal home visiting allows the nurse to actually come into your home 2 weeks after delivery, regardless if you have had a baby, have lost a child, unfortunately, if you've had a stillborn, or if you have adopted a child.
Okay.
So it is absolutely free of charge, and it really gives you solace and peace to know that you're okay. Or if you need a referral, or if there's something going wrong, the nurse comes in, she does an assessment, your family's around, and she gives you some additional education, completely free of charge.
So how do people find out about the services and programs, and how do they access them?
So right now the partnerships specifically are in 6 counties, and we will be getting in more and more counties throughout New Jersey. By the time we're done, we'll be in 21 counties.
That's great.
We are doing bedside recruitment. That means in the hospitals that we are at, we're actually going from bed to bed and saying, hi, you've delivered. You can reach us here. There's a QR code. You make an appointment. You schedule yourself. You can reach us at connectingnj.com through the Department of Health, and there are flyers. You can reach us at pmch.org. You can reach us at connectingnewjersey.org.com. So there are different places that we can be reached. It is just really, really important that everybody knows that it is for every single person. I myself, I wish I had it, even as a nurse, because you think that you deliver, and because you're a nurse, you'll know exactly what to do. But every single person needs that little reassurance to know that, oh, you're doing a great job. Or do you need a little help?
Yeah.
And yeah, I could use a little help with this. Or you have a mother-in-law that's telling you, you need to put some formula in the milk.
Oh, yeah.
And you need somebody that tells her, no, you really don't need to do that. So the nurse comes in and really educates everyone. But if the baby is still in the hospital, the nurse will come back after the baby arrives home from the NICU and also do a reassessment. So that is really a really great program. And then we educate families on doulas. So it's really about the education on what is available to the birthing family.
Okay.
Doulas are a specific patient advocate to assist not only the mother, but the entire family on what is available to you. So they are a patient advocate to help educate on the birthing process, the family planning process, to give the patient that extra empowerment. Because sometimes you go to the physician and you're afraid to speak up because you feel like there'll be some kind of retribution, or you just don't know where to go, and the doula can help you navigate.
So talk to us about some success stories.
So right off the press, just a couple of days ago, we've had a patient, actually a doula patient, a postpartum doula, who went into to see a patient who was feeling a little down. We weren't sure if she was just having postpartum blues or if she was feeling a little depressed because she had a history of depression. This was her second child, and she had a 2-year-old in the home. She was concerned about high levels of lead, because she had been going to the physician, and at this particular point, she had a lead level of 3. And prior to, she had a lead level of 1. So she was concerned that her husband was bringing it home because he was a construction worker. So the postpartum doula went to see her, and she also brought with her our lead team. So we also have a lead team. So that's when I say we have 30 different programs. We can do a lot of different collaboration. So upon going to the home with the lead team, she had just come back from the physician and found out that now her lead level was 5.
Wow.
So
it's just trending
significantly higher and higher. So they found out that it was not the husband, but it was actually the paint.
Okay.
And even though I believe the house was constructed after 1978, it was still the paint that was a problem. Yeah, so we got back the information that it was still the paint that was a problem. So my team started reaching out to the city, and they said, well, because it was only a 4-unit dwelling, there was nothing that they can do. The state that there was nothing that they can do. So they started advocating more and more, well, what are we going to do with this family? And the family, because they were undocumented, they were very concerned because now her lead level is 5. She's undocumented. She has to now provide formula, which is quite expensive. She's terrified. So that adds another dynamic, another layer of fear and trepidation to what's going on. And the doctor said to her, well, don't worry, it's 5. But to the baby, a level of 5, going through the breast milk, that is really a problem. So we were able to bring in different programs. We were able to bring in our nurse-family partnership to help with the nutrition. Even though she wasn't in that particular program, they were able to guide her with education to provide information about different foods that would help bring down that lead level. So our lead team continued to work with the city, and they just had a meeting with DCA, and they were able to actually change the rules about the number of units, because first it was only 1 to 4 units that the city would get involved with. If you were more than 4 units, then that was left up to the landlord. So basically the landlord could say, listen, you're out of here because you're causing too much trouble, and just leave it at that. So I'm really proud of the team. They were able to now change that paradigm. So now anywhere from 1 to 10 units, the city is actually going to get involved and do the abatement and be able to really make a change. So that is a huge success story, and that, something that just really happened. So that's really
That's
great.
a great story.
And that's great, really great for, everyone that lives in that particular place.
So you had mentioned earlier about NRBP and how we've been very helpful to you. Would you like to expand on that and share why your organization is a member of the Newark Regional Business Partnership?
Absolutely. So I did tell you I was a nurse. I was the Senior Director of Nursing at Jersey City Medical Center. And I had been there for 8 years. So being part of acute care, being in the hospital, I was aware of, businesses, and because we were a nonprofit and because I was the Senior Director of Nursing, I did a lot of community work. Transitioning to being the President and CEO of the partnership, I have to do a lot more collaboration with businesses. Unaware of where to start, I met Barbara.
Okay.
Barbara brought me into the fold, and I quickly realized that I was unequipped, to make those connections.
Okay.
And my predecessor had not been part of NRBP.
Okay.
And I was completely astounded that we had this, this like jewel and this person to be able to guide us to what was happening within our community, and I was really surprised that she was not a part of it. So I quickly joined because I saw the value in it. And Barbara was able to usher a lot of different collaborations, a lot of meetings, and it has really been a great not only collaboration, but I was able to meet you. And I was able to meet just so many people and so many different businesses that has really helped expand not only my knowledge, but the way that we work within the partnership.
Okay.
We've had quite a few different collaborations through NRBP that have helped expand our business.
So
and our business
connecting
acumen.
people, businesses, individuals, that's what we do. So it's really great to hear that that's working for you. And we thank you for joining us today. And we wish for more success stories to come.
Thank you so much.
You're welcome. Thank you for joining us. Today's inspirational quote comes from Albert Einstein. Strive not to be a success, but rather to be of value. Thanks again for listening. Thank you for listening to NRBP's Engage and Exchange podcast. Tune in next time for more NRBP member organization insights. For more information about our organization, visit www.newarkrbp.org. Thank you again to our podcast host sponsor, the Martin Tuchman School of Management at NJIT. Additional support for NRBP's Engage and Exchange podcast is provided by PSEG, New Jersey Urban News, Main Street Advisory, LLC.